Today is 21st June 2022 and we are here on Facebook Live from official pages of All India Institute of Speech and Hearing Mysore. It's 2 o'clock here in Mysore. We are all after a very good lunch. So lunch reminds me of food. If you all remember, in our primary classes, teachers had told us that there are some basic necessities for life. Some of it were food, water, air, and shelter. I remember always food and water used to come first. It's sure that no human beings or animals can actually survive for long without food and water. But imagine if food was available, it's there right in front of you, but you are not able to have it. Or possibly the food is there in front of you, you try to have it, but instead of enjoying that food or water, you end up feeling discomfort or you start hating the process of eating or drinking. What if you consulted a doctor for some your health issues and he or she tells you that sorry, from now onwards you will not be able to eat food through the mouth because it's very unsafe for you and that you will have to be fed through a tube for the rest of your life. How would that feel? Or suppose you have a new member in the family, a small baby just born, and you're all happy about the new member. And then you get to know that the baby is not feeling well and may or may not survive. How would that feel? So all these experiences that I just told you is about experiencing a condition called as dysphagia. So that brings us to today's topic, dysphagia in adults and children. I am Gayatri Krishnan. I am a speech language pathologist working at All India Institute of Speech and Hearing, specializing in feeding and swallowing disorders. For today, I will be the moderator of this phone-in program, and I would like to put here that June, the month of June, is celebrated as Dysphagia Awareness Month. So usually speech language pathologists take up activities related to creating awareness among public related to various issues concerning dysphagia, its signs, symptoms, identification, prevention, how to manage, etc., etc. It's a global initiative, and today All India Institute of Speech and Hearing, or AISH, joins this initiative through various programs, and among that, today's program is one. So I take this time to invite our esteemed panelists. We have here Dr. N. Swapna, Professor, Department of Speech Language Pathology, and also Chairperson of Dysphagia Unit, and recently the Center of Swallowing Disorders. Welcome, ma'am. Thank you. I also take this time to invite Dr. T.K. Prakash, Professor, ENT, an invaluable member of Dysphagia Unit, and again, now Center of Swallowing Disorders. Thank you, sir. Thank you for taking your time and joining. We have a very special invitee today, who is Mr. Ananta Shaina. He is a very active, hardworking, self-made entrepreneur, a businessman from Mysore. His presence here is invaluable for us because he is really an addition of value to today's discussion, because he is going to tell us about his own experiences of experiencing dysphagia and overcoming dysphagia. Thank you, sir. Thank you for joining us today. So today's phone-in program again is on the topic dysphagia in children and adults. While we carry on with this phone-in program, please feel free to contact us regarding any concerns, any doubts, any questions that you would want to ask the panelists, or any points that you want to add on to this discussion. Please feel free to pick up your phone and dial this number. I'm going to say this number. If you want, you can note it down. 0821 2502 530. I repeat, 0821 2502 530. So while you connect with us, let me try to bring some basic awareness among the public. I would like to start off with Dr. N. Swapna. Ma'am, I'm sure many of our audiences really doesn't know what is dysphagia. I'm sure many of them are hearing it for the first time. Ma'am, if you would have to explain about dysphagia to a normal person, how would you tell them what is dysphagia?
Thank you for the question, Dr. Gayatri. Dysphagia technically means a difficulty in swallowing. Swallowing is a process with which we transfer the food that we take from the mouth to the stomach. Right? So it's an entire process. When we eat, we swallow. When we drink liquids like tea, coffee, or water, we swallow. We swallow our own saliva also. Many times, in fact, in a day, we swallow our own saliva. And that all happens very automatically, very unconsciously. We hardly ever think about how we swallow. It's a very normal process. But sometimes it can happen that the swallow process itself can get impaired. The whole process of swallowing may become very slow. We may take more time and more effort to actually push the food from the mouth to the stomach. So when this happens, when we spend a lot of time and energy in doing so, that is when we say that the person has dysphagia.
Okay. So just to clarify, ma'am, so in case somebody takes long time to eat, you say that it could be dysphagia?
It's definitely one of the symptoms. Slow eating itself is one of the symptoms. But we definitely will look at the underlying cause, what is leading to the swallowing problem. And if there is some condition or some structure which is leading to that slow swallowing, like weakness in a muscle structure, etc., then we would definitely term it as dysphagia.
Okay. So suppose I'm not feeling hungry, and if I don't eat, is that considered dysphagia?
No, never. Lack of hunger, lack of appetite can happen due to several reasons, in fact. When we are sick, when we are having fever, sometimes we lose our interest, we don't want to eat food. So that is, a separate issue altogether. That will not come under the umbrella term of dysphagia.
Okay, so you're saying that there should be a structural, that meaning to say a problem in appearance or in a problem in how the structures work or move during drinking and eating. That leads to dysphagia.
Exactly.
So that leads me to the question to Dr. T.K. Prakash. So does that mean that it's a medical condition?
Yeah, whenever there is a difficulty in swallowing, that is means a dysphagia, we have to see for any structural abnormalities or what is the reason for difficulty in swallowing. So when we examine the patient and if we find any infective cause, suppose if in the throat, if there is a tonsils which is very much enlarged, very big, so in such cases, in case of children and all, they will feel very much difficulty to swallow. So there is a structural abnormality. The tonsils of the child is very big. So definitely we can tell that it is a medical condition. If you remove the tonsil, it can be reduced. Similarly, in elderly people who have suffered from any stroke or paralysis, they will have some difficulty. Because due to the stroke, they will have difficulty due to the weakness of the muscle which are in the aerodigestive tract. So it is a medical condition. Suppose if we examine all this aerodigestive tract and if we are unable to find any cause, so there is no cause for this dysphagia or difficulty in swallowing, but the patient is experiencing, then we can call it as a functional type of dysphagia or functional type of swallowing disorder, where the intelligence of the patient is not enough to carry out the process of this swallowing. So the patient is not intelligent to swallow. Even if you keep a bolus or a food in his mouth and ask him to swallow, the patient is not swallowing because he doesn't have that higher mental function to swallow it. So this is a kind of dysphagia where we call it as a functional dysphagia. So it is a medical condition. So after ruling out the medical condition, if we cannot come to a conclusion, or if there is no cause, medical cause, which can be diagnosed, then it is a functional, where the higher mental function is not able to conduct this procedure. So there are two types of dysphagia, one is a functional and another is a anatomical or a structural. So it can be due to infection or due to structural abnormality, or whenever some disease part has been taken out due to cancer, so he may feel difficulty to swallow. All this will be under medical part of the dysphagia.
Okay, I understand, sir. I just need a clarification, sir. Many children who have, even if they are typically developing or if they have disorders of developmental delay and autism spectrum disorders and all that, as you said, sir, many of these conditions you cannot pinpoint a medical cause. But many parents keep complaining that my child will not eat that, my child will not eat this, he wants only this type of food. Is that also a cause of dysphagia?
See, that is the what is the choice of the child. If the child wants some good thing like a chocolate and all, it will automatically it will start eating. But if you want a healthy food like grains or some sprouted granules, all those things, it will just delay. So here we cannot tell it is a dysphagia. So it is only the choice of the child there. But actually when the child wants to swallow, if it is not going down or if it is feeling very much difficulty or if the child is experiencing pain or if anything is drooling out of the mouth, the child cannot keep the food in his mouth and it is coming out. All these things will be part of difficulty in swallowing. So that has to be noted and has to be treated.
Okay, thank you, sir. So, ma'am, could you explain as to how to identify if a person is really having dysphagia or is it something else?
Yeah, that's a good question, also very relevant one. Um, in fact, swallowing as such, the process may seem very simple, which does not involve much of effort. But actually, it's a very complex process because so many structures in the aerodigestive tract, so many muscles, nerves, and the brain itself is actually involved in the whole process to make it, work just right enough. So if there's a small damage in any of these structures, it could lead to a swallowing problem. So one way to identify that the person has got dysphagia, an indication, is a cough that can happen during a swallow. That is when, so for example, if the person is having a meal and every time he is swallowing, there is a cough. So that gives us an indication that, okay, there must be some problem. Now, why does this cough occur? That deserves some explanation. So let me just use this model to give you a clear understanding of what exactly happens. So you all know that in our body we have a food pipe and a windpipe, right? So when we eat something, this is, you can see this is the mouth, this is your tongue, okay? And when we eat something, the food actually passes from the mouth through the pharyngeal area, and then it goes to the food pipe, and finally it is going into the stomach. And when you are breathing, the air is entering the nose and then it moves down and goes into the windpipe and finally goes into the lungs. So this is the passage for the food and the air. Now sometimes what happens is when we eat, some part of the food may just get into the airway, that is into the windpipe, okay? And the moment it gets into the windpipe, that is when we have a cough. In fact, cough is actually a protective mechanism. It's good if we have a cough because we are protecting ourselves from the food to to enter into the windpipe. It's a protective mechanism. It's preventing the food from entering the airway, basically, right? So, and I'm sure all of us would have experienced this, coughing at one time or the other. Suppose we eat faster and swallow at the same time, fast. We want to eat fast and swallow fast. That time we might, choke. Or sometimes if we swallow and talking together, if we do that, eating and talking together, that time we might, experience this kind of cough. But that is a one-time phenomenon. It happens very occasional. But the problem comes when, every swallow, almost every swallow in a meal, if the person tends to have this cough, frequent cough every time he swallows, that is an indication that there could be, dysphagia. So at the time when he's coughing, it could also, lead the person to shortage of breath. He may feel breathless. Tears can come down his eyes. It may lead into a choking also, which is a little dangerous situation when he's actually choking. So all this is, these are indications that the food is going down the wrong path. And sometimes it can also happen that the food that we eat comes out of the mouth because the lips are not closed properly. Sometimes we are not able to bite the food because the jaw is not really strong enough. We may not be able to chew it properly and make a nice paste of it. That is again a problem because of the jaw weakness, it may happen. Sometimes we are not able to, push the food from the front of the mouth to the back of the mouth. That may be because the tongue is not moving properly. So there may be a weakness in the tongue.
Sorry to interrupt you, ma'am. We have a caller.
Yes.
Hello? Hello?
Hello.
Yes, madam.
Hello.
Yes, madam. Can we know your name?
Yeah, my name is Anita.
Anita. Hello, Anita.
I'm
You-
calling from Kochi.
From Cochin.
So,
Okay.
yeah. So,
You can ask
my
your
cousin
question,
was,
Anita.
My cousin was having autistic features, so we were taking her to attend therapy here in Kochi.
Okay.
So, they told us not to give her milk and milk products and also not to give her sweets and all.
Okay.
And also she doesn't like some kind of like some texture, some food texture. She doesn't like it. She won't take it.
Okay.
And she's a kid. She's just 3 years old. So obviously at that age we used to we cannot tell her not to eat sweets and all, especially when she is going to kindergarten and all. So is there any alternative? Why are you telling that you shouldn't give sweets or milk to the child?
Okay. Thank you for your question, Ms. Anita. I'll transfer this question to Dr. N. Swapna.
Okay.
She's here. She'll be answering your question.
Okay.
Hello, Anita. Thank you for your question.
Yeah.
In fact, the children with autism spectrum disorder could have restricted food intake, in the sense they may like certain foods very much and they would always want to eat one particular kind of food, and they may avoid certain foods. They do not want to take certain foods. So this is basically because they have an underlying sensory problem, a sensory issue. They may be sensitive, extremely sensitive to certain kinds of foods, and it could be related to the texture of the food. Some children don't like that crunchy kind of food, so they would just hate to hear the sound of that crunchiness or even the texture. They don't like to put such foods in the mouth, so they will have certain restricted food intake, and that is actually attributed to the underlying sensory problem. So we need to any problem is there, we need to find out the cause for the problem, and accordingly in therapy, in fact, that should be addressed. So the foods that the child is sensitive to needs to be noted down, and in a very hierarchical manner, from the least sensitive to the most sensitive, and then slowly this will have to be introduced. Like, just because the child is saying no to the food, it doesn't mean that we will also say don't give the food at all. So it shouldn't be that kind of an approach, but rather we should try and address the underlying problem. So if it's a sensory issue, then I would advise, as a speech therapist, there are desensitization techniques. We would, go about desensitizing the child for the, characteristics of the food. Within the oral structures also some desensitization we would do, and then gradually introduce the child to the food that he is least sensitive to in a hierarchically graded manner. I think that should be the approach.
Also, to add on, if you were told not to give particular food, it could also be related to the diet.
Yes.
Because the child is diagnosed with autism spectrum disorders, there are some research that says it could be food allergy that causes behavioral issues in autism spectrum disorders. So, if you were recommended not to give milk and particular products, it could be related to a possible food allergy.
Okay.
So, you can provide alternatives. As far as I understand, you can meet a dietitian. A dietitian will be able to help you with other foods that can meet your nephew, or who was it? The child?
My cousin.
Yeah, your cousin, to meet nutritional demands. I hope we answered your question.
Yes, ma'am. Yes, ma'am. Thank you.
Thank you for calling.
Thank you, ma'am.
So, ma'am, you were discussing about how to identify if a person has dysphagia. You said choking, you said coughing, tearing. What
Yes,
more?
Yes. Spilling of the food from the mouth, difficulty in biting, difficulty in chewing, difficulty in pushing the food from the front of the mouth to the back of the mouth, and sometimes initiating a swallow itself will become very difficult. The swallow reflex itself will be absent in certain individuals, and sometimes the person will have to do multiple swallows to push the food back into the into the esophagus. They may not be able to control the food properly in the mouth, and suddenly, this food will spill backwards into the laryngeal area, and that can result in choking also. And so these are all, ways in which we can identify. Sometimes liquid comes through the nose as well. That is also, seen. Food gets stuck here in the throat area, or sometimes in between the teeth and the cheek also, the food just gets pocketed everywhere. That doesn't get cleared. Even if you swallow many times also, the food just continues to get stuck, and then the patient will come to you saying that there is some, lump in my throat. I can feel that discomfort.
So, who usually, Prakash sir, the question is for you. Who usually shows these symptoms? Like, is it children or is it old people, aged people?
These symptoms of dysphagia or difficulty in swallowing can arise in any age group. So children in the first 3 or 4 years of their life, there will be some developmental issues and some neuronal problems will be there. So which can be related to the whatever the care that the mother has got during her pregnancy time. So there might be some prenatal causes. So she has to be vaccinated properly in the prenatal period. So many viral infections will be avoided. During delivery time also it has to be taken care so that birth asphyxia, where the child will cry after a long time. So there will be cerebral hypoxia. Hypoxia means oxygen supply to the brain will be reduced in these children. So there are so many issues. Even in the postnatal period, that is after the birth of the child, if the child is having infections like meningitis, encephalitis, all those things can affect the ear centers, which will be controlling the swallowing part. So the child will be having difficulty in swallowing in its childhood or in the infancy. So these problems has to be seen. As we move on, as the age process goes on, when the child become an adult, there will be some infective issues. As I already told, tonsillitis or any structural abnormalities. And as they grow, there might be some tumors in the aerodigestive tract, which will cause obstruction to the whatever the food they are swallowing. So, till the age group reaches the older age group, like 40 to 60, 60 to 70, like that, automatically the intelligence to swallow. So, their cognitive function or higher mental function will gradually decrease. And whatever the salivation that is occurring in the aerodigestive tract, even the salivation will come down. The tension of the muscle, the tension means the strength of the muscles which will be acting for swallowing, they also come down. So all these problems will rise to whatever known as the difficulty in swallowing. And so along with that, some neurological diseases like Alzheimer's disease, where the intelligence of the patient will come down. forgetfulness, or Parkinsonism, myasthenia gravis, or a multiple sclerosis. There are many medical conditions that will attack the person as the age advances. So there are various reasons, and this dysphagia or difficulty in swallowing can be in any age group, but in every age group there are different reasons which has to be tackled.
That's very clear that in difficulty in eating and drinking can affect any person. It can be of any age group, not necessarily child or an adult. But I also understand that it can happen as a part of normal aging also.
Yeah, normal aging also it can occur because as the age advances, all the muscles will become weak,
Weak, okay.
and all the salivary glands which will be mixing the food, the saliva will mix the food and it will make it a paste, which is easy to swallow. Even the salivation will come down.
Correct. So, Antashanavre, how did you get diagnosed? You have experienced this firsthand. Can you share your experience of how you got diagnosed with dysphagia to the public?
Yeah, very good question, madam. First of all, thank you for all the doctors inviting me to share my experience. And initially itself, you have made it very clear that you have everything in front of you, food, liquid or anything. You are not able to take it. What is your feeling? Chiefly, this is what I have faced. So it is a very, very difficult to explain the pain what we are going to get at that time. So at the same time, doctor also explained very clearly, you get cough when you are taking the food. What is the reason, why it is happening, and all. We will not be knowing it unless we come you like you expertise people and take the opinion. This is also very important. I wanted to explain you that I was a quite normal man 1.5 years back also. I never have any symptoms to explain in a big way. This is the problem of dysphagia. Like that, I was also not knowing. So I am a businessman, packaging industry I am running. I was sitting in office. One of my good doctor came to me in the evening, and after all business discussion, I was just telling him, nowadays maybe within the last 15 or 20 days, when I am taking the food, the first bite, I am taking it is asking a little water. So not every time, even that also in when 10 times food, maybe only 1 or 2 times it is asking a little water. I do not know what is the reason like that. Just simply casual I asked, I do not know what is my problem. And I do not know what is that dysphagia. Now only I am knowing the name of the dysphagia. As you said, nobody knows what is that. So doctor also, because of my good friend, he has also not taken very lightly, and he said it may be because of the gastric also. But still, let us go for endoscopy and see what exactly the problem in the throat or your pipeline system. So immediately he referred me to the doctor and went for diagnosis. Then we found that there is a tumor in my esophagus, so system. So it is a shock for me, even because I am very much happy and I do not have any feelings at all. So when we check, that was a cancer also. Because luckily I got traced out in the initial stage itself. I could able to get it operated, and I have now today I am sitting in front of you as a healthy man. I need not have to worry about what is my cancer and all. Yes, after the operation, now what has happened, I will come back to you.
Okay.
This is how I found out that yes, because the swallowing, sometimes it gives very small tips. We should not neglect the small tips also, and we have to go for tests when we grow age, as doctor said. These are all the chances are there. We have to be double careful.
So I just want to clarify, you had difficulty in swallowing before identifying the problem. We have a caller. Hello? Hello?
Hello.
Yes, madam. May I know your name?
Jayashree, ma'am.
Jayashree. Welcome, Jayashree, to the phone-in program. We are listening. You can ask your question.
Yes, ma'am, the thing is, every time I'm eating now, I'm following. My throat is paining a lot. So I wanted to know what to do. Like there's a lot of pain.
Okay. We have Dr. T.K. Prakash, who is an ENT faculty. He'll be answering your question.
Since how many days you are having this?
It's 1 week, doctor.
1 week, yeah. By taking into consideration that it is 1 week, either after examination of the throat, we will be able to see any infection in your throat, like any tonsillitis or pharyngitis. Otherwise, there might be some actus ulcers. So you might have seen some ulcers will be occurring in the mouth. So they will give a lot of pain when you eat some spicy things or hard things and all. Only after examination only we will come to a conclusion. So what is the treatment has to be given?
So, shall we recommend her to meet
Yeah. She should meet ENT doctor and show the throat for examination.
Okay, doctor. Yes.
Thank you, Jayashree. Hope we answered your question.
Yes.
Thank you, Jayashree. Thanks for calling. We were discussing, you had a dysphagia, symptom
Yes.
of dysphagia before the diagnosis.
Yeah.
Did you have it after?
Yeah, after operation also I have the
You had.
problems.
Okay.
So actually, because this is a very important pipeline system, I had an operation in the lower junction of this esophagus. So they have pulled my stomach and joint here. So in the stricture, always very frequently it is get condensed due to this scar and all. Okay, when I wanted to take the food, I could not able to take properly food because of the reduced die of the pipeline. So I went for a temporary stent for 4 months, and after removing the stent, I have a very severe problem. For taking any solid food, I never have any problem. When I am taking any liquid, a small drop of liquid, taking also a big problem for me. So, because of the water shortage to the body, I have gone down by almost 25 kgs in the weight.
How
This is
did
what-
that impact your life, sir?
I told you, in front of me everything, even it is hot summer, I want to drink water, I could not able to take even a small sip of water. It is a real pathetic situation.
It's really frustrating.
Yes,
I'm sure you have gone through a lot with dysphagia. But sir, what will happen if one does not take a step?
See, food is very much essential to our body. All the nutrients of the body will be through our food only. So when this food is missed, there will be lot of consequences that will be occurring. First of all, there will be dehydration. As he was telling, he cannot drink the water, then actually entire body will be dehydrated. There is loss of water content in the body. Next, because he is unable to take the food also, there will be gradual weight loss. The body will become weak. The body's capacity to fight against the infections and other natural enemies will gradually come down. So the immunity of the body will decrease. So whenever there is immunity decrease, the body will be infected by the organisms and it will be weakened. Gradual weakness will occur day by day and it will lead to a serious consequences.
So, as Dr. Correctly pointed out, food is the fuel for our life, and without food, you cannot be healthy for long. So, but also because of dysphagia, he pointed out that if it goes through the wrong route, it can have serious health consequences.
Suppose if the food enters into a windpipe, gradually the lungs will be infected and it will be, the pneumonia infections can occur and it will cause a lot of problems and the patient has to be admitted and treated in the hospital.
Okay. And it's going to be, as Nandashana also correctly said, it's going to impact one's social life, psychological well-being, and the quality of life gets affected. So, what should they do, madam? If like Anantashayana, if there are other people who are experiencing dysphagia, what do you suggest that they should do?
The best thing that they should do is to meet the nearest doctor. at the earliest. Again, I would always say don't ignore, just like how he was saying that one small, indication that the body is giving that there is some difficulty somewhere, that should not be ignored and they should immediately contact the nearest doctor. The doctor will identify what is the underlying medical condition there and then accordingly refer the person to a speech language pathologist. Why that is required is because the speech language pathologist is the person who actually would assess what is wrong, which what's the exact underlying physiological problem that is leading to the swallowing issue in the person, and also provide the necessary swallow therapy. So that is must. And of course, if they know of a speech language pathologist, they can go directly to a speech language pathologist as well.
1 second, madam. We'll come back. Hello? Hello?
Hello?
Yes, madam. May I know your name?
Fatima.
Fatima. Fatima, we are listening. You can ask your question.
Yeah, so thing is my sister had a baby
Okay.
and like inside the baby's mouth, the top part, there's a hole, slight hole.
Okay.
So like from the hospital, they had told that a surgery will be needed for the baby after 3 months.
Okay.
So I like wanted to know if this is the situation, how will it be for the baby to eat, drink and swallow and everything.
Okay. Can I request Dr. N. Sopna to take this question?
Yes. Thank you, Fatima, for that nice question. In fact, that's a very a common problem that is seen, a hole in the top part of the mouth. I'm not sure where exactly is the hole. You didn't mention where exactly. I'm just presuming that the hole is in the palate. Am I right?
Yes.
Yeah. So
Yes, it is a little in the forward.
Okay. So this kind of a hole definitely needs surgical treatment, and so that's the first step that needs to be done. And of course, once that is done, in fact, there are certain methods in which the feeding has to be given. But even during the process, I think the posture in which you're feeding the baby becomes very important because we need to avoid the liquid or milk from coming through the nose, right? So we don't want that to happen. It should go into the stomach. So that positioning of the baby, it becomes very important. And also, if at all, if the child is being breastfed, then again it's very careful to hold the baby also in the right position and control the milk that is actually the baby is drinking. In fact, if the baby is able to suck, you will have to pace it out a little bit so that the milk is coming out in a little quantity, not in a huge quantity, because the moment a huge amount of liquid enters the child's mouth, there is always a possibility that it comes through the nose. So we don't want that to happen. So if at all bottle is being used, there are a lot of nipple variations also of the bottle. So we could use a nipple in which we could control the amount of liquid that is actually coming out at a particular point of time. So that kind of a modification in the nipple also of the bottle, feeding bottle, can be used. Or we could also use a parlor dye. In fact, that is a olle. In Kannada, it is called as a olle. So with that, it is a nice little utensil in which little bit of milk can be taken, and we could, we could get good control on the amount of liquid that is actually milk that is actually going into the child's mouth. So that also could be used during feeding, and we can ensure that the child is having a safe feed.
Definitely. I think it would be better if they go to a speech language pathologist and
Yes.
get these strategies demonstrated
Yeah.
than just blindly following the strategies that we discussed. These are definitely the correct ways of approaching it, but you might need hands-on instructions from a experienced speech language pathologist. That would be our recommendation. Did we answer your question, Fatima?
Yes.
Thank you. Thank you for calling.
Thank you.
Okay. So you suggested that we meet a speech language pathologist to know what is the exact cause of dysphagia and the nature of it. Antashanara, did you do what ma'am suggested?
Actually, yes. In fact, I felt very bad because I have come to you after a long time, more time, wasting my time and experience hard days. I could have come and met you initially only so that I would have come out from the problem. So, definitely after coming to here, I started taking food and water very properly. So, it has helped me a lot.
Okay. So as far as I understand, you have gone through a whole series of doctors, hospitals, testings, and all that. How long did it take for you to get diagnosed and reach till Aish? How many months or how many years?
Actually, after the operation of my this tumor, mm, I lost my voice for 3 months. So I waited for the voice. So doctors were telling after testing it will come, you don't have to worry. And yes, definitely my voice has come back. And the after sometimes because the stricture area which is condensing, even after 7 8 months also it has not that improvement is not come. It will once I go for dilatation, it will be there safe side for 15 20 days, and afterwards again it condenses. And I used to go for 20 days, 30 days, 15 days, like that way dilatation.
So around 1 year gap you took from
Almost 8.
almost 8 months. Okay.
8.
So sir, usually is this much of delay normal in the sense, do they have to go through all this various doctors, or is there a shortcut, or has the team has to be involved?
See, whenever there is a swallowing problem, there should be a team of doctors who are specialized in these problems. So whenever there is a difficulty in swallowing or after radiotherapy or after surgery for the tumor in the aerodigestive tract, usually the operating surgeon will ask them to come and meet the speech language pathologist to improve the whatever the swallowing techniques are there that should be known to the patient very early. Then only the problem can be solved early. The team should consist of the speech language pathologist along with the ENT doctor. The doctor should perform what is known as FEES, or a functional endoscopic evaluation of swallowing, where an endoscope will be passed through the nose and a different consistency of the food is given through the mouth, and we will see where is the obstruction or what is the problem, so that can be assessed, and suitable exercises will be recommended by the speech language pathologist to that particular problem. Along with that, in case of children, if they have some like autism spectrum disorders, or whenever there is a intelligence or a developmental delay, there is what is known as occupational therapist will be there, who will be giving training in all the fine motor activities. That is how to hold the spoon, how to turn it, how to turn the hand, how to bring it, the coordination to the hand to mouth. All those things will be taught by this occupational therapist, and they also form a part of the team. So it is a teamwork will always lead to a good success.
Definitely, sir. So that means that there is a team, and every member of the team have their own roles to perform, be it for assessment or be it for management. So, are there conditions which can be completely cured, in the sense dysphagia causes that can be completely cured through medications or surgeries? That is also possible.
Yeah, there are some medications and surgeries also for not completely cure, but they can reach up to the 80 to 90% cure rate can be achieved.
And after that, it is the speech language
Pathologist.
pathologist role. Ma'am, can you elaborate on what is a speech language pathologist role in management?
Yeah, of course, the main issue there is to ensure that the person has a safe swallow, and at the same time he should be having an efficient swallow as well. But in order to get that in place,
Can we take this question?
Okay, all right.
Hello.
Hello. ಕೇಳಿಸ್ತಿದೆಯಾ?
ಕೇಳಿಸ್ತಿದೆ.
ಕೇಳಿಸ್ತಿದೆ. ಹೇಳಿ, ಯಾರು ಕಾಲ್ ಮಾಡ್ತಾ ಇರೋದು?
ನನ್ನ ಹೆಸರು ವಾಣಿ ಅಂತ, ಚಿಕ್ಕಮಗಳೂರು.
ವಾಣಿಯವರೇ ಕೇಳ್ತಾ ಇದೆ, ಕ್ವೆಶ್ಚನ್ ಕೇಳ್ಬೋದು ಈಗ.
ಸೊ ನನ್ನ ಫ್ರೆಂಡ್ ಅಂಕಲ್ ಒಬ್ರು ಇದ್ದಾರೆ. ಅವರಿಗೆ 1 ವರ್ಷದ ಮುಂಚೆ ಸ್ಟ್ರೋಕ್ ಆಗಿತ್ತು.
ಓಕೆ.
ಸೊ ಆಗ್ಲಿಂದ ಅವರು ಏನು ತಿನ್ನೋಕೆ ಆಗ್ತಿಲ್ಲ, ಅಂದ್ರೆ ಬಾಯಿಗೆ ಏನು ತಗೊಳಕ್ ಆಗ್ತಿಲ್ಲ ಅವರಿಗೆ. ಅವರಿಗೆ ಒಂದು ಟ್ಯೂಬ್ ಹಾಕಿದ್ದಾರೆ ಅಂತ. ಅದರಿಂದ ಅವ್ರಿಗೆ ಊಟ ತಿಂಡಿ ಎಲ್ಲ ಕೊಡ್ತಿದ್ದಾರೆ. ಬಟ್ ಇವಾಗ ಡಾಕ್ಟರ್ ಹೇಳ್ತಿದ್ದಾರೆ ಸ್ಟಮಕಲ್ಲಿ ಟ್ಯೂಬ್ ಹಾಕ್ಬೇಕು ಅಂತ. ಸೊ ಅದಾಗ್ಲೇ ಪರ್ಮನೆಂಟ್ ಆಗಿರುತ್ತಾ ಅಥವಾ ಅವ್ರಿಗೆ ಏನು ಬಾಯಿ ಮುಖಾಂತರ ತಿನ್ನೋ ಸಾಧ್ಯತೆ ಇರುತ್ತಾ, ಹೇಗೆ ಅಂತ ತಿಳ್ಕೊಳಕ್ಕೆ ಫೋನ್ ಮಾಡಿದ್ದೆ.
ಓಕೆ. ಪ್ರಕಾಶ್ ಸರ್, ವುಡ್ ಯು ಲೈಕ್ ಟು ಟೇಕ್ ದ ಕ್ವೆಶ್ಚನ್?
ಇದು ಈಗ ಸದ್ಯಕ್ಕೆ ಅವ್ರಿಗೆ ಊಟ ತಿಂಡಿ ಮಾಡಿದಾಗೆಲ್ಲ ಏನಾಗ್ತಾ ಇರುತ್ತೆ, ಆ ಊಟ ತಿಂಡಿ ಎಲ್ಲ ಈ ವಿಂಡ್ ಪೈಪ್ ಅಂತ ಏನಂತೀವಿ, ಟ್ರೇಕಿಯ ಆ ಕಡೆ ಹೋಗ್ತಾ ಇರೋ ಚಾನ್ಸಸ್ ಇದೆ. ಸೊ ಇದು ಈ ಏರೋ ಡೈಜೆಸ್ಟಿವ್ ಟ್ರ್ಯಾಕ್ಟ್ ಅಂದ್ರೆ ಈ ಕುತ್ತಿಗೆ ಪಾರ್ಟಲ್ಲಿ ಈ ಗಾಳಿಯ ಒಂದು ಟ್ಯೂಬು ಮತ್ತೆ ಫುಡ್ ಟ್ಯೂಬ್ ಎರಡನ್ನು ಕ್ರಾಸ್ ಸೆಕ್ಷನ್ ಆಗುತ್ತೆ, ಇಂಟರ್ಫಿಯರೆನ್ಸ್ ಆಗೋದ್ರಿಂದ. ಸೊ ಇಲ್ಲಿ ನಮಗೆ ಅನ್ನನಾಳಕ್ಕೆ ಹೋಗುವಂತ ಒಂದು ಪದಾರ್ಥ ಏನಾಗ್ತಾ ಇದೆ, ಅದು ಉಸಿರು ನಾಳದ ಕಡೆ ಹೋಗ್ತಾ ಇರೋದ್ರಿಂದ ಆಸ್ಪಿರೇಷನ್ ಅಂತ ಆಗುತ್ತೆ. ಸೊ ಆಸ್ಪಿರೇಷನ್ ಆದಾಗ ಏನಾಗುತ್ತೆ, ಎಲ್ಲ ಫುಡ್ ಮೆಟೀರಿಯಲ್ ಎಲ್ಲ ನಮ್ಮ ಶ್ವಾಸಕ್ಕೆ ಹೋಗ್ಬಿಟ್ಟು ಅಥವಾ ಲಂಗ್ಸ್ಗೆ ಹೋಗ್ಬಿಟ್ಟು ಸಿಕ್ಕಾಕೊಳ್ಳೋದ್ರಿಂದ ಅವ್ರಿಗೆ ಲಂಗ್ಸ್ ಎಲ್ಲ ಇನ್ಫೆಕ್ಷನ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇರೋದ್ರಿಂದ ಅವ್ರಿಗೆ ಟ್ಯೂಬ್ ಹಾಕಿದ್ದಾರೆ. ಈಗ ಆ ಟ್ಯೂಬ್ ಏನಾಗುತ್ತೆ, ಆ ಟ್ಯೂಬು ಅನ್ನನಾಳದಲ್ಲೇ ಇರೋದ್ರಿಂದ ಸೀದಾ ಹೊಟ್ಟೆಗೆ ಹೋಗ್ತಾ ಇದೆ. ಸೊ ನಾವು ಈ ಪೇಷಂಟ್ಗಳನ್ನ ಹಾಗಾಗಿ ಅನಲೈಸ್ ಮಾಡ್ತಾ ಹೋಗಬೇಕು. ಸೊ ಈಗ ತುಂಬ ದಿವಸ ಆಗಿರೋದ್ರಿಂದ ಅವರು ಟ್ಯೂಬ್ ಬಿಟ್ಬಿಟ್ಟು ಡೈರೆಕ್ಟಾಗಿ, ಯಾಕಂದರೆ ಟ್ಯೂಬ್ನಲ್ಲಿ ಎಲ್ಲ ನ್ಯೂಟ್ರಿಷನ್ಸು ತುಂಬ ಕ್ಲೀನಾಗಿ ಸಿಗೋದಿಲ್ಲ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಸ್ಟಮಕ್ನಲ್ಲಿ ತೂತ ಮಾಡಿ ಅಲ್ಲಿಂದ ಫುಡ್ ಕೊಡೋ ಥರ ಮಾಡೋಣ ಅಂತ ನಿಮ್ಮ ಡಾಕ್ಟ್ರು ಹೇಳಿದ್ದಾರೆ. ಸೊ ಅದು ಮಾಡಿದ್ಮೇಲೆ ಅವ್ರಿಗೆ ಸ್ವಲ್ಪ ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಶಕ್ತಿ ಬಂದು ಇಂಪ್ರೂವ್ ಆದಮೇಲೆ ನಾವು ಮೇಲ್ಗಡೆಯಿಂದ ಟ್ಯೂಬ್ ಹಾಕಿ ನೋಡ್ಬೋದು, ಅವರಿಗೆ ಸ್ವಲ್ಪ ಆಹಾರ ಕೊಟ್ಟು ನೋಡ್ಬೋದು ಅದು ವಿಂಡ್ ಪೈಪ್ ಒಳಗಡೆನೆ ಹೋಗುತ್ತಾ ಅಥವಾ ಅನ್ನನಾಳಕ್ಕೆ ಹೋಗುತ್ತಾ ಅಂತ. ಒಂದು ಸತಿ ಯಾವಾಗ ಫುಡ್ ಅನ್ನನಾಳಕ್ಕೆ ಸೀದಾ ಇಳಿಯಕ್ಕೆ ಶುರು ಆಗುತ್ತೆ, ಮತ್ತು ಗ್ರ್ಯಾಜುಯಲ್ ಆಗಿ ಈ ಉಸಿರು ನಾಳದಿಂದ ಅನ್ನನಾಳದ ಕಡೆ ಯಾವಾಗ ಫುಡ್ ಮೂಮೆಂಟ್ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ ಆ ಟೈಮ್ನಲ್ಲಿ ಈ ಟ್ಯೂಬ್ನ ತೆಗಿಬೋದು. ಸೊ ನಿಮಗೆ ಒಂದು ಆಶ್ವಾಸನೆ ಏನು ಕೊಡ್ಬೋದು ಅಂದರೆ, ಕಾಲಕ್ರಮೇಣ ನಾವು ಈ ಟ್ಯೂಬ್ನ ತೆಗಿಬೋದು. ಬಟ್ ಅದಕ್ಕೆ ಮುಂಚೆ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡ್ತಾ ಹೋಗ್ಬೇಕು. ಪ್ರತಿ 1 ತಿಂಗಳಿಗೆ ಒಂದ್ಸತಿ, 2 ತಿಂಗಳಿಗೆ ಒಂದ್ಸತಿ ಈ ಅನ್ನ ಯಾವ ಕಡೆ ಹೋಗ್ತಾ ಇದೆ, ಇದು ಉಸಿರು ನಾಳದ ಕಡೆಯಿಂದ ಏನಾದರೂ ಅನ್ನನಾಳದ ಕಡೆ ಹೋಗ್ತಾ ಇರೋ ಚಾನ್ಸಸ್ ಇದ್ದರೆ, ಸೊ ಆವಾಗ ನಾವು ನಿಧಾನಕ್ಕೆ ಈ ಹೊಟ್ಟೆಲಾಗಿರೋ ತೂತನ ಮುಚ್ಬೋದು, ಈ ಟ್ಯೂಬ್ನ ತೆಗೆದು ಬಾಯಿನಲ್ಲೇ ತಗೊಳ್ಳೋ ಥರ ಮಾಡ್ಬೋದು. ಅದ್ರ ಜೊತೆಗೆ ಭಾಳ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂದರೆ, ಈ ಸೆರಿಬ್ರೋವ್ಯಾಸ್ಕ್ಯುಲರ್ ಆಕ್ಸಿಡೆಂಟ್ ಆಗಿರೋ ಜನಗಳಲ್ಲಿ ಎಲ್ಲ ಮಸಲು ವೀಕ್ ಆಗಿರುತ್ತೆ, ಅದರಿಂದ ಫಿಸಿಯೋಥೆರಪಿ ಚೆನ್ನಾಗಿ ನೀವು ಕೊಡಬೇಕಾಗುತ್ತೆ.
ವಾಣಿಯವರೇ, ಐ ವಿಲ್ ಆ್ಯಡ್ ಆನ್, ಅದಕ್ಕೆ ಅದ್ರ ಜೊತೆನೇ ಸ್ವಾಲೋಯಿಂಗ್ ಥೆರಪಿನೂ ಕೊಡ್ಬೋದು. ಟ್ಯೂಬ್ ಹೊಟ್ಟೆಯಿಂದ ಹಾಕಿದ್ರೂ ಸ್ವಾಲೋಯಿಂಗ್ ಥೆರಪಿ ಕೊಟ್ಟು ಇಲ್ಲಿರೋ ಮಸಲ್ಸ್ನ ಸ್ಟ್ರಾಂಗ್ ಮಾಡ್ಬೋದು. ಅದು ಮಾಡಿದರೆ, ಎಕ್ಸಸೈಸ್ ಮಾಡಿದರೆ ಅಲ್ಲೂ ಶಕ್ತಿ ಬರುತ್ತೆ. ಶಕ್ತಿ ಬಂದಮೇಲೆ ನುಂಗಿದ್ರಲ್ಲೂ ಈಸಿ ಆಗುತ್ತೆ. ಓಕೆನಾ? ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು. ನಿಮ್ಮ ನೀವು ಹೇಳ್ತಾ ಇದ್ರಿ ಮ್ಯಾಮ್, ಮ್ಯಾನೇಜ್ಮೆಂಟ್, SLP's role in management.
Exactly.
What you are explaining about that?
Yes. In fact, it is very much relevant to the question that Vani asked as well, because many people have the same issue that they are on the tube and they just want to get out of the tube because definitely they don't enjoy the experience of eating food. It's not a pleasurable thing to eat, put something into the nose and then getting into the stomach. Of course, it will fill the stomach, but you lose out on the pleasure of eating, that enjoyment of eating, you lose out on that. So as a speech pathologist, my main aim will be to get the person out of the tube and get him to feed through the mouth. So that is going to be my main aim. But then before doing that, I have to do the assessment, find out where is the exact site of impairment, which muscle is weak, which one is not moving properly. So I will do an assessment to find that what is the severity of the problem I would find out. And ultimately, I would take a detailed history to find out what are the aspects that are actually causing the problem. I would also check whether his higher mental functions are right or not, along with doing an oral examination and other related tests. In addition, of course, sometimes I would have to also take the help of instruments, like how Dr. Prakash was saying about the fiber optic endoscopic evaluation of swallowing, because certain movements are invisible to the eyes. At the level of the mouth, you are able to see it, but then at the level of the pharynx, if something is wrong, if at the level of the larynx or at the level of the esophagus, if something is wrong, you can't see it. You will have to, that is when we'll take the help of the instruments to check on which muscle is, not moving, because there are so many events that are happening, very important events that are happening there. And everything has to happen at the right time in good coordination and everything. So I, that's when, sometimes an ENT specialist, we work in a team, and sometimes I would have to take the help of a radiologist, because there are instruments which will give me images of all of these, levels of swallowing, which will help me to choose on the right line of treatment. And that is very important, because we have to ensure a safe swallow and at the same time ensure an efficient swallow. So we have to we have to recommend certain exercises based on where the underlying problem is. Suppose the problem is, the tongue is not moving properly. So then we would suggest tongue strengthening exercises. Suppose, the food is going down the wrong path, then there are some exercises like supraglottic swallow or supraglottic swallow, which is again, which will prevent the food from getting into the airway and ensuring that the vocal folds, that is the voice box, is actually closing tightly when we are actually swallowing. And like that, there are several exercises. I don't want to go into the details of that. There are several exercises that we would recommend, and at the same time, to ensure that there is a good safe swallow, I would also recommend some diet modifications or some changes in the head posture or in the body posture, head position or body posture. These are temporary changes that I would suggest for a safe swallow.
Maybe Anandashana can elaborate because he has gone through this. He has gone through this phase. So, could you share your journey briefly from having symptoms of dysphagia to right now?
Okay. After the operation, I could able to take a solid food properly, but liquid food I could not able to take even a small sip also, small drop also. So after, as Dr. Prakash said, group of doctors met and all tests thoroughly. Then they have suggested you have to go for a swallow therapy. So swallow therapy, luckily I am also Mysorean. I am having a very good institution in speech and hearing. So we came here. So after you give me swallow therapy, how to swallow is very important. We before coming, I was also know what is that? What is there in the swallow therapy? I put everything in mouth and it goes inside. What is there? So it is not like that way, because I am also fool having understood like that way. So there is a lot of techniques in swallowing, and where we can push the whatever product we put inside the mouth, it can go safely to our stomach. So taking the drop, small drop also was very difficult. Within 15 days, I could able to drink 1 glass, 2 glass, 3 glass water continuously without cough.
Right now?
Right now I am taking without cough 2 to 3 glasses. But I am not telling that 100% I am okay. But I am now able to manage. Now this situation is more than enough for me to survive. That is how the situation has come. And I am now very much confident that I am definitely going to be still safer side within a few months. This is what the position. I am able to take liquid also, solid food and everything properly. And I have started increasing my weight by almost 4 to 5 kg plus weight also has come.
Thank
And thanks to all the doctors too.
That's very nice. Very happy to hear that. Sir, what would be your closing remarks? So, considering that we have discussed a lot of issues related to dysphagia, identification, assessment, what is that one message that you want our viewers to understand from today's talk?
Dysphagia can be prevented or it can be reduced by following some of the healthy habits in our life. So today is the International Yoga Day. So everybody practicing yoga, automatically your all the muscle strength will improve. And gradual loss of the strength of the muscles, everything will be in a good tone. The tension of the muscle can be maintained by doing these exercises. So a good healthy lifestyle. Try to avoid all alcohol beverages, alcohol and also tobacco products which will cause cancers, all those things. So this cancer will lead to dysphagia because that part has to be removed. Invariably the patient will go for a dysphagia. So, and also take good precautions for the would-be mothers during pregnancy, postnatal period and all. So many childhood infections can be prevented which can have an effect on the brain of the child which will lead to dysphagia. So a good healthy checkups in the pregnancy period, a good safe deliveries and postnatal period, that is after the childbirth, good immunization to the child to prevent all meningitis and encephalitis infections and a good diet. All these things are very much important. And finally, I want to tell a good healthy lifestyle will prevent this kind of disorders and the aging process can be delayed by doing yoga and other exercises. And this is the message I want to give on this precious day of
Yoga.
International Yoga Day.
Thank you, sir. Thank you so much. And Shanare, do you have to pass on any messages to the public?
Any changes you come across in your daily what you experience and some small changes, please don't neglect it. Whatever it may be, very small changes in the food swallowing system, please do take it to the proper doctor, get it experienced so that initially anything can be corrected very easily. When it goes to the optimum level, correction makes very difficult and also problem for you. So that is one suggestion. And any problem, definitely there is a solution. And please, you have to meet the proper doctors so that you will have the solution for that. And for that, I am the better example and I am experienced good in that. Thank you.
Thank you so much. Ma'am, could you?
Yeah, I think what I would like to say is that contact the nearest speech language pathologist. They are the right people to assess the problem. They work in a team, and if at all any swallow therapy is required, it is they who provide the swallow therapy. And definitely, they are the leader of the team, and you should definitely approach a speech language pathologist. And definitely don't ignore any swallow problem that you are facing at any point of time.
Thank you so much. So with this, we conclude today's program with a short message that neglection is the biggest problem. You be aware that such conditions are prevalent, and it actually, we understand that it affects a person's life more than just a small issue. Even as many of us have experienced, a small throat pain or a cold itself can frustrate you by not letting you talk enough or not being able to communicate enough. So a problem like dysphagia, however small it is, we understand that it has a huge impact on a person's life, and All India Institute of Speech and Hearing is always here to help you out, swallow safely and adequately, to help you progress through your life in a more healthier way. So be aware, but don't be scared of it. As Ananta Shaina already said, every problem has a solution, and the team is here to help you out. So please feel free to contact us anytime at Dysphagia Unit or the Center of Swallowing Disorders, All India Institute of Speech and Hearing, Mysore. Thank you very much for joining us today. Hope today's session was helpful. Thank you.